let me make myself smaller. All right. Hi, everyone. My name is Summer Tavasci. So I did my translational project on formalized mentorship programs for new graduate nurses. So before I get started, I would like to thank my faculty chair, Dr. Dupre, and my community chair, Linda Hanzelko. Both of their unwavering support and guidance have helped me navigate both this project and this program. So without both of your dedication, I would be lost. So thank you for you both. I truly appreciate everything that you have done for me and for where this project stands right now. So a little bit about the background and history of this problem. Despite the generalized orientation and nurse residency programs, new graduate nurses, or NGNs, as I'll refer to them in this presentation, they commonly report lack of a skill set and self-confidence, high levels of stress, and low levels of job satisfaction when they start out on their jobs as nurses. So beside critical thinking and clinical reasoning, there continues to be gaps in entry-level competencies in numerous areas. Some of these areas include communication, leadership, conflict resolution, stress management, and organization. So a structured mentorship program post-nurse residency can foster increased learning and improve comfortability when transitioning from student into a more professional role, which led to the development of my PIGO question. In new graduate nurses, how does the implementation of a formalized mentorship program following an intensive care unit nurse residency program compared to current practice affect the perceived self-confidence and intent to stay over a 6-month period? So my project was implemented between February 1st and July 31st of this year in the cardiovascular intensive care unit at Advent Health Orlando in Orlando, Florida. My project was deemed a quality improvement project, which utilized qualitative and quantitative measures. These were measured using 3 Likert scale-based surveys administered pre, mid, and post-mentorship program, knowledge and skill-based milestones, which were placed throughout the already existing mentorship program, informal meetings with mentors to discuss milestone achievements of the NGNs, and informal meetings also with the NGNs to discuss program progression. A total of 12 new graduate nurses participated in this translational project, but they had to meet the inclusion criteria. So that was that each participant must have completed a general hospital and unit orientation prior to the start of my project. They had to have less than 1 year of intensive care unit experience, and they needed to participate in the unit-specific mentorship program. Additionally, their mentorship program needed to be entirely completed during my project completion. So of the 12 participating new graduate nurses, only 11 responded to the pre-program survey, and only 9 of those 11 completed the mid and post-program surveys. So therefore, I only had 9 participating NGNs. 6 of those 9 were female and 3 were male. And then I also included information from 6 mentors who provided input throughout the project. So the innovation to change practice. To improve the confidence and the intent to stay of the new graduate nurses in the CVICU, the already existing mentorship program needed to become more formalized. The existing program, it lacked standardization. There was really no standard expectations for the new graduate nurses throughout the program, so nobody really knew how they were to progress. So with the addition of achievable skill-based and knowledge-based milestones that were placed throughout the existing mentorship program, both mentors and new graduate nurses were able to be in agreement with where the new graduate nurse should be progression-wise throughout their program. These placements of the milestones were discussed with the unit manager, the educator, all of the mentors, and the new graduate nurses who recently completed their mentorship program also provided input. A total of 5 meetings occurred prior to project implementation with combinations of these people to discuss placement and to kind of discuss really what needed to be added, what needed to be omitted, and make sure everybody was on the same page. New graduate nurses received a copy of the mentorship program expectations and milestones upon beginning their mentorship program prior to February 1st. So outcomes and impacts. The 3 surveys that I mentioned, the pre, mid, and the post, measured indicators of self-reported confidence, the NGN's intent to stay, and their feelings and emotions that they felt throughout the progression of the program. Informal meetings with mentors and mentees provided additional insight that was not readily available through survey questions. And paired t-tests were utilized to compare results from the recurrent questions from the pre-mentorship survey through the post-mentorship survey to determine any statistical significance. In addition, I also utilized components from Melius's transitions theory and the leader-member exchange theory. So to revisit, the purpose of Melius's transition theory is to describe, explain, and predict human beings' experiences in various types of transitions. In this case, the transition being from student nurse to professional nurse. So using this theory had allowed for inclusive assessment of the new graduate nurses' patterns of response, including feelings of stress, feelings of hesitancy, and adaptation and anxiety. So this theory aided in addressing individual learning needs. And additionally, each new graduate nurse responded and adjusted differently to instability and stressors throughout their individual program. The leader-member exchange theory is a relationship-based approach that focuses on a two-way relationship between leaders and followers. In this case, the leader being the mentor and the follower being the mentee or the new graduate nurse. High-quality relationships of this exchange are those that exhibit mutual trust, support, and respect. So therefore, each new graduate nurse in this case had varying opinions on the supportive structure of their relationship with the mentor. So goals and outcomes. I've reached all of my short-term goals. So the short-term goals I included were a 30% increase in confidence levels, that same percentage increase in intent to stay, and the increase in reported support systems. Long-term goals, however, were a different story. The 75% increase in confidence levels I have met, which you will see on my slides in just a few, but I did not reach the 75% increase in intent to stay. And then the reduction in nurse turnover is still to be addressed. I'd probably address that maybe in a year, just to kind of see long-term effects. But going back to the 75% increase in intent to stay, there was no turnover during my project. But maybe if I were to redo the project, I wouldn't include this, only because many nurses come to the CVICU in order to get their experience, in order to go on to nurse anesthesia or nurse practitioner. So I might have not included this in my long-term goals. So now for the fun stuff. I understand this slide is very busy. I don't want you to read it. I just want to generally explain what it is. So this slide shows the mean response given on the Likert scale to the confidence levels of different activities and responsibilities of a nurse on this unit, both on the pre-mentorship survey, the mid-mentorship survey, and the post-mentorship survey. All I want you to take away from this slide is the increase in reported confidence in every single activity and responsibility in all the categories, from the pre-mentorship survey, which is the light blue, to the post-mentorship survey, which is the darker blue color. I will go into more detail on the next slide. I do want to mention that these results were statistically significant in regards to the confidence levels. This indicates that progression through a mentorship program resulted in an improvement of the confidence levels with the P equal to 0.001. So I highlighted 3 specific activities and responsibilities as a CVIP nurse. These are the 3 most improved confidence level areas of my surveys. So those 3 areas are calling and updating doctors, knowledge of patient population, and questioning medications or provider orders. These particular skills are important because without a solid understanding of the patient population and without efficient communication with medical staff, appropriate patient care can be delayed. And additionally, questioning specific medications or orders, especially when they're in a power plan or a power set, is a key skill when it comes to high acuity patients with labile vital signs post-operatively. Similarly, what you're looking at here is the mean reported responses for the intent to stay of new graduate nurses on the pre-mentorship, the mid, and the post-mentorship surveys. So overall, the data reported that new graduate nurses were willing to stay in their positions for at least 18 months. Reported reasons for leaving thereafter included furthering education. Some people said they wanted to move outside Central Florida. And others just wanted to complete the required time commitment contract and then reevaluate their career goals. About 4 participants said that they were interested in becoming CRNAs, and 2 participants said that they were interested in becoming nurse practitioners or completing that route of study. These results were not statistically significant according to the paired t-test with a p equaling 0.223. Similarly, the project team was interested in examining reported feelings and emotions of new graduate nurses throughout their program. So overall, the data shows an increase in comfortability and a decrease in being scared, nervous, and overwhelmed. Oddly enough, although all NGNs had said that they felt supported in their informal interviews, here we show a slight decrease in the feelings of support on the survey responses throughout the program. This could be suggestive of a mismatch between a mentor and a mentee, overwhelmed with increased independence, or maybe the reflection of just a poor survey completion after like a negative encounter with another member of the healthcare team, or just maybe after a generally stressful shift. So what do I recommend? These findings are consistent with prior evidence-based literature that imply that the utilization of a formalized mentorship program promotes feelings of inclusion, support, and increased confidence in new graduate nurses. So for the most beneficial results, I think that the focus should be placed on the departmental need, the management and staff support, and a fixed timeline. That said, the CVICU at this particular hospital, they hire a large amount of new graduate nurses at almost monthly intervals. So the unit is considered highly specialized, but has shown a high turnover rate through previous years. Part of that could be attributed to the fact that the nurses are coming in for the experience and then leaving for furthering education. But the staff and management support was monumental. So I do recommend that communication among all involved parties must remain open and continuous throughout the process. So the most impactful program length remains undetermined, but longer programs are suggested to provide more support and increase confidence. That said, research suggests that the most beneficial mentorship programs last as long as 24 weeks. This program in particular that I implemented lasted between 19 and 22 weeks. And oddly enough, 0 out of 9 participants said the program was too long. 7 said that the timing was the perfect amount, and 2 actually said that the program length was too short. I would also add monthly mentor meetings if I were to do this over to facilitate more open communication and reinforce expectations, make sure everybody's on the same page. I would also use a larger sample size and follow throughout the year as opposed to just 6 months. This would improve the accuracy of the data and confirm results. And I would also repeat the project when the observed unit is not affected by repercussions from a global pandemic. During this time period, the unit was affected by staffing shortages, as well as differences in patient population that we normally do not see. So implications and sustainability. New graduate nurses, mentors, and management alike were totally satisfied with program expectations, layout, and structure. So with the successful results from this translational project, all new hires on the CVICU at Advent Health Orlando will be required to take part in this formalized mentorship program after their initial preceptor-based unit orientation. The subsequent follow-up of the mentorship program purpose and goals should take place quarterly with mentors, management, and educators, and program changes should be made as determined appropriate if needed. Future programs may also find success by modeling the program similarly to this one, but adjust their program accordingly to consider specific departmental needs, skill sets, timeframes, and experience level of their new hires. And as always, the additional importance is to know that everybody adapts better than others. So the individual response of each new graduate nurse should be considered separate from the overall program, accomplishments. So my dissemination plan. I already presented my project findings to the unit nurse practice council, the unit manager, the unit educator, and the cardiac service line management team. This was well received, and it prompted an open discussion of immediate changes to the current programs. Some of these changes included increased program length, adding milestones, and checking in with mentors and mentees more frequently. I also have plans to present to the management team overseeing all other ICU service lines, and then in a few months to disseminate those projects, the project and those findings to overall hospital executives for a modified inclusion in all orientation pathways, including those of experienced nurses as well. And additionally, I would like to disseminate project findings to the academic journals, including American Journal of Critical Care, Journal for Nurses in Professional Development, and Nursing Education Perspectives. And as my colleagues have said, I have met all DNP essentials with the completion of this project. However, I do want to focus on 1, 3, 6, and 8. I utilize Essential 1 by using nursing theories as the foundation of this quality improvement project. For 3, I utilized evidence-based practice to formulate a potential solution to the practice problem. For number 6, I worked with professionals across multiple disciplines to get this project up and running as smoothly as it did. As my community and as my committee knows, it was not an easy start. And for Essential 8, I helped develop deeper relationships between the staff members on our unit, and I strengthened the team using mentoring as a supportive approach for professional growth. And as I mentioned previously in the coffee breakout session, the personal growth I experienced with this DNP project outweighed a lot of what I felt, because for those that don't know, I was either pregnant or postpartum during the entirety of this program. I have 2 under 2. I worked full-time, so school full-time, work full-time, and mom full-time. It was quite hectic. So I am super proud of my accomplishments personally, professionally, and academically. Here are some references, and I will gladly open this up to questions if anybody has any.
Thank you so much, Summer. We'll open the forum up to your committee first.
Linda, I'd go ahead and thank you so much for all your support and help of Summer through the project. So I'd love to hear your comments.
I am so proud of Summer. She has, like she said herself, I cannot believe she did everything that she did with having 2 babies at the same time. I have worked with Summer since Summer has been an NGN, and her growth is amazing. The project was incredibly needed, and it is working extremely well. I've been proud to work with her we work together in the same unit. So to see it progress through the unit, and actually I'm been part of her project as a mentor myself for another NGN. So it has been just a really wonderful experience. I'm really happy to be proud of it, and she did a great job.
Thank you, Linda.
Summer, I just had a question about the skill-based milestones. Can you tell us a little bit about just a sample of what some of those milestones were? Sure.
Yeah, we have, I wish I could pull it up, but I don't, it would take me a while to find it. So what we decided with the people that I've talked about, the unit manager, the educator, some prior new graduate nurses. So some of the skill-based milestones that we put into the project were discussed at different weekly intervals. So an example would be, by week 4 of your mentorship program, the new graduate nurse should be able to identify changes in a patient regarding, say, change in vital signs, a change in breathing, and they should be able to take care of certain types of patients. For example, you should be able to take care of 2 stable ICU level patients with maybe 1 titratable drip each. And then say by week 8, that skill-based milestone would expand to the new graduate nurse should be able to take care of maybe one step down or PCU level patient with a more complex ICU level patient who perhaps is still intubated and on, maybe 4 titratable drips. So the progression kind of was decided upon with all that group of people. And similarly, the same thing with knowledge base. The patient should be able to know what nitroglycerin does, should know what norepinephrine does, and the certain titratable ranges that we use on our unit. So these milestones, like I said, should be specifically catered toward each unit, dependent on what they would like to see progress throughout their programs.
So that, in light of the skills that they had to accomplish at certain periods during the mentorship, I think the confidence level results you had are pretty significant as far as being confident with being new to a unit, being a new graduate, and to be able to accomplish those difficult, complicated skills. So
right, and it is all dependent too. Some of the feedback I received from our new graduate nurses at the completion of the project said that without the mentorship program, they really wouldn't have been as competent in their skills based off the milestones, because it really is all dependent on how your preceptorship, your unit orientation went. You're just assigned a preceptor in the beginning. So if you don't click with your preceptor, sorry, but your X amount of week orientation, you learn what you learn. If you don't click, if you don't have the same learning styles with that preceptor, I'm sure a lot of people here can attest to it. You don't learn well if you're not really clicked with the person you're assigned to. So being the mentorship program, there's no directly assigned mentor to you. You're kind of just whoever the mentor is on the shift. Their job is to basically oversee what you're doing, check your charting, kind of come up to you and say, hey, what's going on with your patient? What can you tell me about your patient? Are there any issues? The mentor is meant to be a guiding force, not a direct person to come to and say, hey, what should I do? The mentor is basically meant to develop on the critical care skills. So a lot of people found benefit utilizing this program, and especially the milestones that kind of have checkable places that they can say, oh, hey, I should be here by then. Maybe I should read up on this before I come to work. Or maybe I should ask if I can have, a more stable patient while I brush up on some of my skills. So a lot of the new graduate nurses were very thankful for that.
very good. Thank you.
Anybody else have any questions, quick questions that I can answer for you before our little break? Awesome. And thank you again, Linda. It's been fantastic, kind of coming full circle, starting, at the beginning years back, and then coming full circle and implementing this program, adding more structure to it. It's been great.
It's been super great. I've been very happy to be part of it. Thanks, Summer.
Just as a reminder, Summer will be in her poster room this afternoon, so you can share additional feedback and ask questions of her. We will commence with our first break of the morning and come back promptly